We're going to get this meeting started. So welcome to the November 18th Board of Health meeting. Start a meeting and with the Pledge of Allegiance, please.
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you everybody for being here. So I wanted to get a review and approval of the October meeting minutes. So do I hear a motion to approve?
Yep.
Okay,
Okay.
two. Okay. Motion to approve the October meeting minutes. Thank you very much. And Marie, would you give us the health officer's report, please?
Sure. Good evening. Not too much went on this month, but I just want to talk a little bit about, and I know you and I were talking about it before the meeting, but on this past Friday, November 15th, they held the Suicide Prevention Task Force held a listening tour here in this room in Radnor, and it was one of the largest turnouts that they've had so far, and it was very interesting to be a part of that and kind of listen to what went on. There were over 100 people in attendance. There were, the public was here, they shared their personal stories, they gave their suggestions to the panel. So it was a really kind of interesting afternoon. While I was there, I picked up some information. It looks like the Delaware County Suicide Prevention and Awareness Task Force, they have their own task force. They are hosting the 16th Annual Regional Symposium, where their topic is What About Tomorrow? An Integrated Approach to Preventing Suicide. And that is on November 21st from 8:30 to 4. And you can find out more information about that on their website, delcosuicideprevention.org. So I'm going to make sure I got that out there. And that's kind of it. Thank you.
So is that resources for community members, like what to do? Did you get any like objectives or what they're for that that's a long day?
It is a long day. So I have the pamphlet here I can forward to everybody. It looks like it's going to be a breakdown of kind of, they're going to have breakout sessions, talk a little bit about suicide awareness, and I'll forward that information to you. It's a packet that they have.
Okay, great. Thank you very much. Okay, anything else with the health officer's report? Inspections, anything?
Nope, that's it.
Wow.
Thank you. It's
Okay.
a slow month.
Okay, great. Okay.
Oh, well.
Okay, so I wanted to, old business, so I wanted to ask the board, we had Mr. Whitmer here last month to talk about now and in the future with birds and the decline in the bird population, and I didn't know if we wanted to do anything as a board or any recommendations that the board might have felt that we should follow up on or otherwise.
He did mention the issue of mosquito spraying, and I thought, well, not just I, several of us thought that maybe we could follow up on that and see if it would be viable for Radnor Township not to mosquito spray anymore. I don't know, but that's a possibility.
Radnor Township does not mosquito spray.
They do not.
No, it's done by, it's a state, and it's essentially through Delaware County. Paul's infinitely familiar with it.
And I would hesitate to jump from the notion that there is spraying that can make some eggshells more fragile to the notion that the health of Radnor Township would be better if we didn't mosquito spray without some clear-cut measure of what it would do locally for the bird populations. And I'm not sure that the local songbird population issue that we have here can be directly tied to the insecticide issues with shell fragility. I think that that's actually probably a different collection of songbirds. And I'm going deep in this because the birds are very, very meaningful to me. I've been feeding birds here since I moved here 20 years ago. There are changes in the bird populations. And I don't know what Mr. Whitmer said, and I wasn't there for that. But I can tell you that one of the things that has dramatically affected our local bird population, knowing that 29 billion have disappeared from the world, in the last however many years, it was a UN-based study, is that we protected raptors, and there are more raptors. So you actually see red-tailed hawks and golden eagles in the area, and they've chased most of the cardinals away. I know that to be a fact. I do my own counting in my own backyard. So I'd be a little hesitant to jump to a notion. I mean, to me, it's the same argument as should we not control the deer population because we like deer, despite the fact that it's pretty evident that being overrun by deer affects the local population. So I'm kind of disinclined to the notion that we in Radnor can do anything specific related to what is a global issue. Sorry, I had to get that off my chest.
I did think that they mentioned something about backyard spraying. Did Dr. Whitmer talk about that? Like the dangers of spraying the perimeter of yards to prevent mosquitoes, for example.
I think his concern about mosquitoes was not related to the density of egg shells. It was more to do with wiping out a large part of the birds feeding. They live off of mosquitoes, amongst other things. So if you destroy the mosquitoes, you will deal with West Nile virus and the threat from that. But in doing that, you then have the unintended consequence of destroying some of what birds live on. I think that was the point he was making. I found it.
I spend a huge amount of time outside in the summer, and there's no shortage of bugs. I've actually noticed a significant decrease in the mosquito population, but we've got now a huge population of these black gnats. So again, and I'm sorry to interrupt, but I'd be very careful before we took another action, because these things are always kind of like puzzles where you push in at one spot and it comes out in the other two spots. So, but I think that we could take on the notion of we're doing a lot of spraying, and I'm not sure that all of that spraying has been vetted. They now have these mosquito companies, and they're laying down things that are actually pheromones that are drawing. One of their major attractants is a Japanese beetle attractant, and I don't know the degree to which that particular industry, the compounds being sprayed are vetted for not being particularly harmful to human health at a federal level, and then they're entitled to spray, but to what extent this is being regulated in a way that we understand the impact on our local environment. And again, I apologize to interrupt.
So all good points and food for thought. So I thought I would just bring it forward and, put it out there to see if there was anything else that we wanted to do with that. The talk was excellent, and you can certainly, no, don't be sorry. I mean, we encourage, opinions, so that's perfectly fine. It's on the website, so I would encourage you to take a look at it. It was videotaped. You can go on YouTube and check it out. So, all right, something to think about. All right, Jane was going to talk about the student interns and their projects for new business.
We met before this meeting, and they had a proposal that they presented to us, and we kind of worked it out to make it more simplistic, and we have a plan, and I'd like for them to share it with you.
So the main focus of our project is going to be analyzing mental health at RHS and to find out what's the most common stressors of students at high school and how we can find out how to help them and help them cope with their stress. And the most important part we think of our project is especially trying to give advice to the students and getting this information. And the reason that we believe this is so important is because stress has so much impact on students' mental life and their daily life and social lives. So we think that helping students realize what could be the problem and how to solve it will help them with their emotional health. And Leah's going to go over how exactly we're going to do this.
Okay, so we were thinking of starting off with like an initial survey to give out to the Radnor High School students to see like what specifically causes their stress and like where they find troubles in managing their stress. And then from there we want to dive more into like specific research. as to like how we can, like why those are stressors for them, and also like how we can prevent that or like limit that stress. And we're also thinking of putting out maybe like a website or articles in the school paper to help like bring awareness to our study and also like the mental health issue that we particularly focus on. I think that was it.
And what we were going to do is limit the stressors to the two most important stressors that students are experiencing, because we just thought it would be too all over the place if we went into a lot more than that. So if, for instance, a big stressor for them would be the amount of schoolwork or parent relationships, they would focus on those as opposed to every single stressor that is common to teenagers.
Yeah, and that's what would really help with like the surveys. We'd be figuring out what is specifically like the needs of the Radnor High School students, so we can like make our project more specific.
That sounds really good. So in terms of survey, do you have any like ideas of how you would survey your classmates?
One of our ideas is to go through the school newspaper, and they usually send out a link to all the students, so the students can click on it and take the survey electronically, or else we can also ask guidance counselors or teachers to hand them out to the students.
I use SurveyMonkey. It works amazing, so you can set up in 5 minutes, and that might be something to consider. I did it for something recent on Friday, literally on my couch in like 5 minutes. I got the link and sent it out, and I got 2 responses in like an hour, so I was pretty surprised. So that might be something. It's free and pretty easy to use, so just an idea.
Yeah, that sounds like a great idea. Thank you for the advice.
Paper can be cumbersome, and then people don't fill it out, but a
Yeah.
link might be good.
All right, thank you.
So that's great. Thank you, Jane, for facilitating that. That'd be great. Thank you very much, and that's really good. So maybe get a little progress each month on where you are, and certainly you can reach out to us for any questions, et cetera, and we'll give you some guidance. So that's great. Thank you so much. Okay, so in terms of future presentations, I got an email from Roberta Winters and about the public health study that's being conducted through Johns Hopkins University, Bloomberg School of Public Health. And basically, they're doing an assessment on delivery of health and public services in Delaware County. And there's some specific focus groups set up December and January. And basically, they're going to make some recommendations on how to enhance and strengthen services in our county. So I would recommend anybody, did we send that link out, Marie, for everybody? So it's basically going to be a way to determine health needs of our residents and identify gaps in delivery and services in the county. So I did sign up for the December 10th focus group, which is for healthcare providers, and there's other ones available. So it might be a really good. Dr. Schartz-Hopko, who was a former Board of Health member, is going to that. And we will have a presentation to discuss this more at our December meeting, so I thought I would just bring that up. And everybody did get that email? Okay, so feel free to do that. Okay, so I don't have anything else. Is there any announcements or anything?
I just, this may be more old business, but from our presentation 2 months ago about vaping deaths, there was a release from the CDC last week, about 4 days ago. So I just thought I would bring it up because at that meeting we were talking about, what could be responsible for these deaths. They are suggesting that maybe vitamin E acetate. It's been found in lavage samples from patients. Let's see, 29 patients, and it was found in all the samples. So possibly that may be going on. They're recommending, as far as a health issue, not using any products that, contain vitamin E acetate. But as we know, at the meeting 2 meetings ago, we don't really know sometimes what's in these products. But I just kind of wanted to bring that up because I noticed that in the news I think 4 days ago was the release.
Thank you very much. I'm right on top of it. I've been doing a lot of work around that. I went to the Radnor PTO, I guess, a few weeks ago and spoke in a conference 3 weeks ago about vaping, and they did coin the lung injury called EVALI, which is an acronym, EVALI, for e-vaping associated lung injury, is what they're calling it now. So I don't know the number of deaths where we're at just yet, but it's, creeping up there. And what we did find is, you're exactly correct about the vitamin E being the base, and mostly with THC compounds or marijuana, liquid marijuana, and it's the illegal stuff. So that is the strongest link.
Yeah, as of last week, this press release says 42 deaths in 24 states and DC.
It's scary. So we're looking at a health system right now at possibly screening these folks better, finding out what they're vaping and how they're vaping and that sort of thing, and looking into providing some resources for our youth when they come in to, when they visit our hospitals. So, yeah.
Is there a township health issue that we could address here? I confess my ignorance. I don't know what township ordinance is related to smoking. I don't know what township ordinance is related to vaping, but if our vaping ordinances are not at least as stringent as our smoking ordinances, I would suggest that the public health circumstance dictates that they should be, and that we might consider making that recommendation to our Board of Commissioners. But I am completely ignorant on both of those questions.
So I know we've addressed the smoking in public spaces in the past. So smoking is banned in restaurants.
By township ordinance?
Yes. Correct, Commissioner Nagel? Would you say that?
I thought it was.
Yeah, I'm almost sure.
No.
But that's my point, is if it's a township ordinance that dictates public behavior of smoking, then should we expand the township ordinance that dictates public behavior around smoking to include vaping? And I think that we could agree, maybe as a group, that the evidence is that probably we could make that recommendation as a public health recommendation.
Well, the only problem with that is the ordinances for not smoking in public spaces are all predicated on secondhand smoke. There is no correlation that I've read about with vaping and secondhand smoke.
Well, I'm sorry. Yes, there is a public health concern. There's all kinds of chemicals with vaping. So maybe I need to bring my presentation back here. I
Yep.
could certainly talk on that. So cigarettes, they say there's 7,000 chemicals in cigarette smoking, and there is a whole plethora from arsenic, cyanide, like all kinds of stuff. I mean, I would beg to differ that there's definitely a public health risk with vaping.
Not disagreeing, I was just
Yeah,
saying I
yeah.
haven't read any
Right.
studies that support that.
Yeah, there isn't anything. You're
So it wouldn't
definitely
be
correct.
evidence-based.
Right. Yeah, the jury's still out. There's so much to learn yet around this.
So there's
So
no,
it would not necessarily be evidence-based with relationship to the exposure of individuals to secondhand smoke and their potential risk, but it might be evidence-based in that we are developing pretty significant evidence that specific types of vaping, that we are having difficulty identifying exactly what those specific types, are associated with a newly identified health syndrome, and that as a township, I would think that we could take the measure that in order to discourage behaviors that we understand are associated with health risks for members in the township, that we would take the same stand with vaping that we have with smoking and discourage that behavior by restricting it to the ability that we have to restrict it in public spaces. So I agree with you completely. I can't draw a direct link.
Yeah, and the only thing I would suggest is if you and the board feel that way, take a vote, make a recommendation to the commissioners that they consider that.
I think the
I think we
concern,
need to see a little more evidence before you would say no vaping in public places. I mean, I understand your argument, but the argument in the case of tobacco is strongly evidence-based, and that there seems to be a real shortage of evidence around the whole vaping thing. I mean, hopefully, we will get that evidence before too much longer, but I wouldn't be in favor of trying to ban vaping in public without a lot more hard data.
Dr. Simmons, are you talking about outdoor, strictly outdoor, or?
So I opened my comments with an admission of my complete ignorance, of my ignorance of the understanding of what are the township ordinances and what we feel comfortable in this township regulating with regard to behavior. And I certainly, one of the reasons that I turned to smoking was because I would make the assumption that restrictions of smoking behavior are based on solid legal basis, based on the long-term history. I agree completely with Dr. Crotty that the evidence connection is limited, and based on my own experience with going in front of not even the board but the planning commission with an incompletely validated hypothesis, I wouldn't want to do that without having some form of connection. But I would say I'm not sure, back to what you said, that we need to have an ironclad connection between secondhand vape exposure and secondhand health risks if it is the desire of the township to promote healthy behaviors in public spaces. But I agree, we're nowhere near there yet.
Yeah, I mean, you could say that you shouldn't be drinking alcohol, and, you know, you could say alcohol has many health risks associated with it as well, so you shouldn't be able to drink alcohol in public spaces. So I think we need to know about secondhand, you know, exposure and influence, perhaps before you're able to ban vaping as well as tobacco. I mean, primarily that's where tobacco, where we have you know, things behind us, is because of secondhand exposure.
The thing that concerns me with the vaping, that I would contradict myself a little bit in terms of my stance on cigarettes. Cigarettes are sort of a known hazard. They're a chronic hazard. Vaping is a big mystery, and it's been associated with deaths already, and acute deaths, acute problems, acute sickness. And the other problem with vaping that makes it a mystery is that we don't even know what's in the stuff. And depending on the manufacturer, and sometimes kids buy it from other suppliers, there can be other things hidden in what they think they're getting that can make them sick, that have even killed people. I honestly think that we should do away with vaping altogether in this township. I think we should make it illegal. And I'm not concerned about secondhand smoke as far as vaping or as far as cigarettes, because I really think the concentrations are so low. But, you know, I think just from Linda's presentation, I think, and then from reading I've done since and news stories and all that, I think there's ample evidence that it's been associated with problems. We don't know enough about the cause or the chemical ingredients that all of which are the problems, although the vitamin E is one of them. But I think it's enough of a red flag. I don't even think vape products should be sold in this township. I don't think the Wawas or any of the convenience stores should be allowed to sell them in this township, and we are able to ban that, and I think we should. But I don't care about the secondhand smoke from vaping, because I think in the outdoors, I think the concentrations are too low. But certainly the individual who's vaping is putting themselves at risk. So.
But there's many products out there. I mean, there's, you know, e-cigarettes, which, you know, I would have a fit if my kids were using them. But, you know, if you're banning all vaping, then you're banning those as well.
Get rid of it all.
How do you think the board will take that?
The poor solicitor would be inundated with questions. That's where we'd start the discussion.
I just want to clarify, I do believe the township does not ban smoking in public spaces as far as parks and sidewalks, correct? It's just restaurants, just to clarify. And I know the FDA is looking at the whole vaping situation because they let the products go to market, commercialize them without evidence, saying it's a promising product for trying to encourage people to quit smoking. Now, of course, it's going down a whole other path, but I know the FDA is all over this as far as, is it really going to be what it should be as a product to help people quit smoking? That's where they're at with the whole vaping issue. It's not coming out that way, but the evidence is not suggesting that, but I think the FDA is all over about getting that research in, and I think we need research before we can go to the board solicitor.
And we kind of are, conflating is a strong word. The vaping circumstances, you've actually broken it down. There are a couple of different pieces to it. The way I read the literature, and I followed it pretty closely on this acute syndrome of acute lung injury, I think that the deaths are not isolated to, but concentrated on the THC side versus the tobacco side. But since there are in both, it's hard to argue that it's either exposure to consuming tobacco or THC products, and that the concentration of the illness and the fatality probably relates to an excipient or a contaminant, because the population that's getting sick is more likely buying not non-FDA approved products that are not as carefully manufactured and might just throw in some vitamin E oil to cut or to expand the product. There are, as you've pointed out, a wide array of different vaping methodologies, which are going to have different temperature ranges, different ways in which they will affect the incipients and excipients. And we don't really know what the health effects of long-term vaping without the contaminants that appear to be causing the lipoid pneumonia. So to Dr. Capuzzi's notion, it is a big black hole. My suggestion is, and I'm sorry, well, I'm not terribly sorry, but I did raise an issue that became a morass, but I would love to start with trying to get a better understanding of what the township ordinances are around smoking. Look at what those ordinances are and what the basis is, and use that as a basis for any further recommendation that we might make as our understanding of vaping and vaping-related illnesses resolved. Because we could take something to the Board of Commissioners about banning vaping outright in the township, and I don't believe that it has a prayer in hell of passing.
The only difference is that with the township ordinances on cigarettes, and I think it had also was going to apply to the parks, that in the parks they have to be in a certain segmented, sequestered area to smoke. But with the cigarettes, the issue was secondhand smoke affecting people around you. But we're willing to let people who want to smoke hurt themselves, but not other people. The vaping, like, we kind of already know what the whole cigarette deal is about, but the vaping, I don't think the secondhand smoke is a concern, or vape or whatever it is, with vaping or with cigarettes. But the vaping, the difference is the harm to the individual doing it. And I don't know, I kind of think we have to step in. We can't tell people they can't do it, but we can certainly prohibit it when we see it, and we can prohibit it, which means in the public, and we can prohibit the sale of it. And that's all we can do. But I think we should.
My understanding, too, is that it's used recreational. High school students, do you see your classmates vaping or other students
Well,
for fun?
like in school, a lot of people used to vape, I think, right? Like a lot of people did used to vape.
Yeah.
But now they've like banned it at school, and like you get like, can you get suspended for having it now?
I don't think you get suspended.
But you get detention definitely, and like it gets confiscated sometimes. And like I think a lot of people do it like when they're at like parties and stuff as well, like. So it's not really like out in public that people do it. It's more so like, and at like their friends' houses or in their own home, which I don't know how you could limit that necessarily. And I feel like it's mainly teenagers who are vaping, like, or young adults rather than like, smoking is kind of seen through like all ages, where vaping is more like younger people. If that has anything to do with it.
Do you think that vaping is policed at the schools, at the school? Do the teachers check the bathrooms? Do they check, outside of the school? Are they good about that or not?
Yeah, they do check the bathrooms
Yeah.
and sometimes they lock them too.
Like before the LM Pep rally, they definitely like lock the bathroom so people won't go in and like do stuff. Like before big events.
Yeah.
And I would say like since like last year is when they put into place a lot of the like rules pertaining to vaping, and it used to not be well regulated, but now since a lot of people have started vaping, like they've become more strict about it.
Yeah. They also have like a vape kind of class where if you get caught vaping, you have to like attend this like mandatory.
Yeah, you have to attend
session.
like the like I don't know what her name is, but she like deals with like not addiction, but like those kind of like drug and alcohol problems like in teenagers at our school.
Another question is, do the students, now that there's so much information out there about how bad it is, do you see your fellow students self-regulating that it's not cool to do it anymore, or do they still do it despite all of the information that's out there?
Like none of my close friends personally vape that I know of, but like I know other people that I'm friends with, like they said that like, a lot of their guy friends used to vape, but like now since like a lot of information has come out and like people have died because of like illnesses related to vaping, that like they've stopped doing it. Like people who used to do it just like recreationally like aren't as like apt to do it. But like I think people who still like I think it's very addictive, and people who do it regularly are still doing it. But not as much.
I think it has gone down since like we were freshmen.
Yeah, it was really bad when we
Yeah.
were freshmen, but now as juniors, you don't see it as much.
Yeah, I don't see it as much as I used to as freshman year.
Yeah.
So I'd be curious to see nationally, I don't know if anybody wants to take it on, to see if there's been any ordinances or rules or regulations that we can maybe follow. I'm just stabbing out there like what maybe other places have done in terms of like rules and regulations might be something interesting.
I think there's been a handful of states. Federally, no. Federally, it's still, they're waiting for the FDA to collect the evidence that they're hoping to get to see if this is a promising product. Again, with their summation that their hope is that this would cause smoking cessation, and I don't think it's out there yet. So they're waiting for that, but I think Michigan, I'd have to check back. New York? Well, did they push it through, though, finally? I think there's been noise, but I don't know if anybody's actually pushed it through.
I'm sorry, I don't have my stuff. I know there was some states looking at legislative action, but like, I know Massachusetts, New York off the top of my head, but I'd have to look at that.
In Massachusetts, it's under litigation in state courts. Other states, including Michigan, Rhode Island, Washington, Oregon, New York, have banned all fruit and candy flavors or have taken steps to do so, and that's from October 13, 2019, from the Atlantic.
Okay, well, I think we've had a lot of good discussions, so how do we want to move forward? I mean, we have an opportunity. Should we collect some information and bring it back next month, looking at data
Well,
out
like I
there?
said to you, maybe it's a good idea to get the school educator in to help us understand what's going on at the schools from her perspective. Do you know the name of this teacher or the educator that the class is with, that the?
I'm not sure who it is, but like I'm sure if you contacted, like who would they, like either administrators or like guidance counselors, they'd be able to give you her name.
Because there is a concern about the young individuals, because that's where the addiction starts with cigarettes at a younger age. So is it or is it not a deterrent? I don't know.
So any suggestions, how to move forward or what we want to do?
Just to note, it's just something I just looked up. It says, as of April 2019, so it's not even the most recent data, 13 states, 2 territories, and 841 municipalities have outlawed vaping in smoke-free public areas. So in other words, they're taking it, if it's tobacco-free, it also should be vaping free.
Which was what my notion was in the first place.
Yeah.
So maybe we need to understand what the Radnor Township smoking ordinances in detail are. It's all coming back, David.
Okay, so why don't we work offline and look at the ordinance and then come back and discuss this next month? And then maybe get some of the law and legislative, if you don't mind pulling that up. And then we could circulate that before the next meeting and get an idea of how we want to move forward. I think that'd be a good first step. Okay, all right, good. Good discussion. All right, and then just lastly, it's not too late to get your flu shot, so we're approaching upon flu season, so I would encourage everyone to get a flu shot. And our next Board of Health meeting is Monday, December 16th at 5:30. Oh, one last thing. Marie, the dates for next year, did you get those?
They don't go to the board until I think the first week in December for approval. So as soon as they come out, I will forward those.
Okay, great, because I know there's some date changes with the presidential holiday, so just put it on your radar, because we got a little mixed up last year.
January and February of next year, the meeting is on Tuesday instead of Monday. But it's
Okay, so January and February, so it'll be the third Tuesday of the month. Same time, same place. Okay, 2020, yeah, just make note of that. All right, good. All right, well, if there's no more comments, meeting is adjourned.